gentlemen, are you ready?
Introduce yourself.
Good morning, ma'am. First of all, thank you so much for giving this opportunity to introduce myself. My name is Remark Tandingan Albios and I am 21 years of age and I am from the beautiful place of Upper Katituan. I have completed my Bachelor of Science in Nursing degree from the Mindanao State University Buog campus during the years 2016 to 2020. So, I am a patient-focused and a registered nurse with compassionate and hardworking nature, seeking position with growing medical practice. So, looking for teaching experience and extensive knowledge in healthcare to help improve the lives of patients.
What are your weaknesses and how can you take advantage of it?
When I was elementary up until high school days, I have this weakness and I've noticed that I'm shy to share my ideas when it comes of presenting to others. But when I grow older, I have this biggest weakness which is to lose the lives of my parents. So that's why now I am doing my part as a son. I was studying hard to be more successful in life so that I can pay back all the sacrifices that my parents have done. While they are by my side, I was really motivated and inspired to give all the things that they haven't experienced before as a rewards for being a good parent.
What is your edge over the applicants? And why should we hire you?
Honestly, I don't know the other applicants. That meant to say, I won't have any basis of what their skills are versus what I have currently that I can offer to the table. I know for a fact that I have confidence about, I'm sure of my strength that I can bring it to the table. Just to give you an idea, I am very adapted to changes. I can do self-paced development. Back to the question, why should you hire me? Precisely because I have the 3 E's, which means the expertise, eagerness, and effort. Expertise because I am confident that I have the ability to do the jobs right. I have the eagerness. You can be assured that I am doing my jobs well and I always looking forward for a positive the output of result. And I have the effort. You can be granted that I can work under extreme pressure and I'm so excited to show it to you once I get hired.
Are you a team leader or a team player? Why?
For me, I consider myself as a team player simply because I believe that working in one organization as a team player, it should always have the word teamwork rather than an individual. Working in a team environment, it gives you the motivation to work good and contribute in a team with a joyful and easiest way.
What should you consider yourself before accepting a job?
So for me, the things that I consider before accepting the job is the employee's benefit. Because working in this kind of field, it needs discipline and self-awareness. This is not an easy job for every nurse because you are going to encounter a lot of patients with different attitudes. So the nurse must know their benefit from this organization.
Why did you choose to become a nurse?
So, when I was a child up until now, I saw my mother during at night suffering a lot of pain in her body, and as a child, I feel so sad looking at my mother experiencing those situation. So probably she's my inspiration and I choose nursing because I really want to help my mother and I want to take care of her. And what I have noticed, to be a nurse, it will never a choice, but rather it is a will and a divine calling from God.
What was your favorite clinical experience? Why?
So for me, my favorite and unforgettable clinical experience when I was assigned to assist to a woman who gives newborn babies, and I saw what happens before and after she gives birth, and I am happy because I am part of the team who help and care for the woman going through her difficult of giving birth. And of course, that's my favorite and fulfilling experience ever.
How will you react when a patient's family is dissatisfied with your care?
So for me, in this kind of situation where the family of my patients are dissatisfied with my care, so the best way to address or react on this situation is by easily approaching the family. I'm going to ask them to share what they are expecting to my care, and by listening to their concern and respect, I can also add and explain that as a nurse, we can perform the part and responsibility of being a nurse, and I can also explain to them that the work of the nurse is different from the doctor's work. So by this kind of approach, we can easily identify and solve the problem.
How will you handle a patient who chose not to communicate or disclose important information?
So for me, handling this kind of situation, first and foremost, I will respect the patient confidentiality, because we know that the confidentiality is usually thought as an ethical issue. So the obligation of confidentiality goes beyond undertaking not to divulge confidential information, and it also includes responsibility to make sure that all the records containing the patient information are kept securely.
If we will hire you, would you still accept the job if you will learn that the salary in this organization is usually delayed? Why?
Precisely, yes. Because first and foremost, the purpose why I applied here as a nurse, because I want to share my knowledge and skills that I have by simply helping and improving the healthcare of the patients. Because I have this philosophy in life that if I cannot deliver my purpose, so what's the use of my 4 years degree in college? That's why I was studying hard just to improve my knowledge and skills, so that someday I'll be the one who take good care of our fellow Filipinos.